Where to find behavioral services for adults with dual diagnosis in Durham region. Presented by Iman, Elijah, Sequoia, and Zane. Presented in our table of contents, we will first introduce Ontario Shores, a brief description on public teaching hospital that provides a range of assessments and treatment services in Durham region. Then we will talk about the service provided, a detailed overview of the specialized behavioral services for adults with dual diagnosis. Then we would mention the related legislation, a provided description of the applicable legislation/policy or guideline in Ontario. Lastly, we will discuss the positive and negative implications of the applicable legislations.
Dual diagnosis is when an individual with developmental disabilities is also experiencing mental health issues and challenging behaviors. This presentation will focus on services for adults with dual diagnoses within the Durham region. Ontario Shore Centre for Mental Health Sciences is a public teaching hospital that provides a range of specialized assessment and treatment services for those with complex mental illnesses. This beautiful facility offers inpatient and outpatient care located in Whitby, Ontario, a part of the Durham region. Ontario Shores is a place for healing, recovery, and hope, with over 40 specialized programs for clients in need of mental health supports, while also offering family resource centers for caregivers as a therapeutic space to share knowledge, access resources, and connect with other families to support and encourage. Ontario Shores is passionate in providing the highest quality of care and actively advocates for mental health concerns and plans to incorporate an emergency mental health unit.
We couldn't understand how can you wait for 6, 7, 8 hours, and then when the patient sees the psychiatrist, they're literally within 5 minutes they're discharged. So it really leaves you with feelings of concern that you were let down by the system.
It's an experience Shane Christensen says no one, let alone a parent, should ever have to experience. His son, who lives with schizophrenia, was taken to a number of hospital emergency rooms over the years, where Christensen says he wasn't treated fairly compared to other patients.
You felt that you weren't welcome. There was a sense of almost as if you were imposing on the people and the patients who were there for medical issues.
According to Dr. Philip Klassen, a lead psychiatrist with Ontario Shores, this is an all too familiar story among mental health patients, which is why the hospital is advocating for one of these.
It's a great opportunity to change the face of emergency mental health.
It's called an empath unit, a facility that would provide temporary, around-the-clock emergency care for patients facing urgent mental health matters.
Providing active treatment and at all costs avoiding restraint, seclusion, and control measures, even for people in acute distress, is to an extent a paradigm shift, but I think a very important one whose time has come.
Dr. Klassen says there's been a 25% increase in mental health visits in Durham over the last 4 years, while substance abuse visits are up by 40%. With the empath unit, doctors say the patient would be seen immediately, allowing them to receive treatment faster and ultimately freeing up much-needed inpatient beds. The model is already being implemented in 20 hospitals across the U.S.
The empath unit idea came specifically, how can we help these folks? Because what we've seen from our research is that the vast majority of them don't need to be hospitalized if we start treatment for them right away.
This ultimately putting less of a strain on emergency wait rooms, which are currently brimming with COVID-19 patients. Ontario Shores and its stakeholders hope the government will invest in this concept, given the data points towards a dire need. Brittany Rosen, Global News.
This facility, website, and program is easily set up to find services based on the client's needs, offering inpatient and outpatient care in over 40 specialized programs. This allows personalized and accessible recovery care. Simply select an age, in or output patient, and the specialized focus. Today we will examine Ontario Shore services for adults living with dual diagnosis.
Ontario Shores offers a dual diagnosis service that is a 10-bed specialized inpatient unit for individuals with an intellectual disability and a mental health disorder with challenging behavior. It involves an in-depth assessment using a collaborative interprofessional approach based on evidence-based and individualized programming. This includes life skills, recreation, supportive counseling, and group activities. Their behavioral assessment involves a functional assessment along with training and education for the individual's family and or caregivers. Services include specialized interprofessional assessments, diagnostic clarification, medication review, individualized programming, behavioral assessments, family support and education, inclusion of community partners, discharge planning, and outreach services such as assessment, consultation, education, and community support. Ontario Shores also offers a dual diagnosis outreach service that provides assessments and psychiatric consultation, as well as guidance in connecting individuals to appropriate community resources. The eligibility requires individuals to be between 18 and 65 years old, medically stable, and have an intellectual disability diagnosed before the age of 18, typically with an IQ below 70, along with serious mental health disorder and or challenging behaviors. Referrals are usually made by physicians or psychiatrists, and the documentation of the intellectual disability may be required.
When it comes to legislation applicable to behavioral services for adults with dual diagnosis, the Services and Supports to Promote the Social Inclusion of Persons with Developmental Disabilities Act 2008, or SIPDDA, stands out above others. This act outlines and defines which services and supports are available and the applicable funding and logistics such as minister oversight for populations with developmental disability over the age of 18. Moreover, the Act outlines requirements needed in order to access these supports, including but not limited to professional services and person-directed planning supports, which is the section of this law most applicable to behavioral services for adults with dual diagnosis. It is also important to note that this law also outlines the funding aspects of these supports as well as structuring the way that these services run, including various forms of enforcement, including inspection and compliance orders amongst these agencies if they are failing to comply with the Act. This is to say that this legislation mainly governs the components at play when it comes to adults in Durham Region with dual diagnosis seeking these behavioral services. Yet, what informs these agencies and community services in ensuring that they are adhering to the legislation? This ties into our next section, guidelines. As for guidelines, the Joint Policy Guideline for the Provision of Community Mental Health and Developmental Services for Adults with Dual Diagnosis outlines the rules that agencies must adhere to while providing these supports for this population. The legislation mentioned above outlines the legal requirements when it comes to these services, whilst the guideline managed professionally how one should navigate in their practice and adhere to the rules outlined. These guiding principles were laid out by the Ministry of Health and Long-Term Care and the Ministry of Community and Social Services, the purpose of which is to lay the foundation for these supports and populations to ensure effective and accessible care across various sectors when concerning this population. Furthermore, providing appropriate definitions and assumptions regarding the delivery of services and the population being served. The guideline also outlines provincial roles and functions such as the ministries listed prior, as well as support for local roles and functions to help ensure that these service providers are adequately supported.
Now we will be discussing and analyzing the implications under the legislation. First point on the positive implication is the emphasis on social inclusion and provided support. The build between community participation and interpersonal relationships have bridged many forms of support for those eligible in ways that not only address the medical, but social, functional, and communal. The second is person-centered planning. This legislation branches the link between holistic care and the law, creating support towards the individuals rather than the institution. This is a major strength as it personalizes and creates a flexible model of services in Ontario. Now on to the negative implications under this legislation, starting with the eligibility criteria and how it could be exclusionary. Using age as a requirement for access to support and services create a huge barrier to those who still depend on those services after the age of 18. Because even with age, their diagnosis typically doesn't change, and the level of needs that they require. On to wait lists. A quote from Tenzin Kando 2024 disclosed that more than 42,000 people are waiting for community support services, including staff, caregiver, employment, and mental health services. This discrepancy from waiting periods significantly delay access without building safety nets during or after. Now let's talk about analyzing the implications under the guideline, starting with the positive, detailed setups for community networks of specialized care. This guideline provides details on community networks like specialized care that involves community agencies. This streamlines the information and access for those with dual diagnosis, expanding on options and methods that they can use. The second positive implication is the local and provincial support, as it strengthens the service needs and resources in local communities by identifying and prioritizing the gaps and barriers. Now on to the negative implications. No third vote, clashing between institutions. While the power of cross-sector collaboration, provincially and locally, can be ideal, there is negative consequences that could occur if collaboration fails or reaches an impasse. Similarly to the 3I framework of policy development, institutions that structure guidelines can overturn the proposal of a candidate's case made by the other party. And without citing further guidelines on how it would be able to move forward without affecting the individuals under this guideline, more time would be delayed for their needs. And the last negative implication for this guideline is the fact that there is no enforceable guaranteed access to support and services. The common expectation to be waitlisted still presents as a critical limitation that leaves individuals relying on availability or capacity. Here are the resources for more information. Thank you for watching.